this video, we're going to talk about alternative methods of treating back pain and specialists. Hi guys, this is the second part of the other video that I had of who treats back pain. My name is Kamala. Yes, that's my real name. And thanks for tuning into my channel, Healthy Back Girl. So please like and please subscribe because I have more. One thing that I want to say about all of these medical professionals who help you treat your back pain is that it's good in the initial stages when you're just learning about what's going on with you, what you need to fix, what you need to work on, and trying to find out what exactly is the diagnosis. That's what it's good for. And if you have a doctor that referred you to any of these specialists, then obviously you need to go get that stuff taken care of. Hopefully your insurance does pay for that. However, what I'm trying to say is once that stuff is over and insurance no longer pays for it, all of these specialists do cost. They add up. So somebody like a physical therapist, somebody like an occupational therapist, any of those number of doctors, you're going to have to pay them out of pocket for each of those visits because it's not something, dealing with back pain is not 1, 2, 3 simple. Okay, yes, you get your referrals for your 6 to 8 sessions or however many they think is good for you, which is basically like a couple of weeks to a couple of months. But let's be honest, if you really have some issues with your back or chronic pain, it's going to take a lot longer to recover. Sometimes it could be months or years. Now, for me personally, it did take a couple of years. So you might want to consider that before you're shelling out money to, pay for all of these specialists. First are acupuncturists. They are not necessarily doctors, but some doctors are acupuncturists, which is kind of confusing because it probably means that an actual medical doctor can have a certification or some kind of training in acupuncture, and then they perform those kind of methods. But a regular acupuncturist might not be a doctor. They don't have to be. So what they do is they talk to you to figure out what's going on with you, what are your problem areas, and they use tiny little needles to stick into different meridian points on your body, which are energy points. And in Chinese medicine they call it like your chi. These are just like points that they manipulate different sources of energy to get it to flow in the right way. Test you, they examine your face, they look at your tongue, your eyes, and the problem area to see, what's going on with you, because I guess they could tell a lot by looking at that. And then they put all these little teeny tiny needles inside of you. Well, not all the way inside, just on top of your skin. And they manipulate it. They kind of move them around to see, what the reaction is with your body or your nerves. And that basically lasts around 20 minutes. And you do feel a little weird with those things inside, but I guess it does do something for the pain. Some people do say it works. And then they remove it and there is some sort of irritation and a little bit of blood. Next up, a reflexology, which is people that massage you, but only in limited places, like your ears and your palms, your feet, because they say those are different parts that line up with the rest of your body. So if they touch a certain section, it's affecting the other parts of your body. You just sit wherever they want you to. It could be in a public place, if at all you ever end up in that situation, and they'll rub your feet, rub your hands, and they'll rub your ears, which, like I said, each of those body parts are connected to certain parts in your body. So that's another alternative method of trying to easing back pain. Another one is a massage therapist, and there are several. There are many massage therapists, which is why I have this video to be a series, like a second part. Next up, we have massage therapists. They are not doctors. Um, and there are several different massages that they do. And this is why I had this in the second part of the video, because there are several massages that are good for different reasons. First up is like a regular massage, a full body Swedish massage, and it's basically like a light pressure, light touch, and they go through your whole body. With this, you should be undressed, and they just massage your whole body, and you know, it's basically to relieve pressure and some sort of tension that you have. Next, the hot stone massage, which is like having a Swedish massage but with stones. So they basically put the stones in the parts where you're having issues, and they're hot, which is why they call it a hot stone massage. So aromatherapy, and that massage is basically a full body massage, and they use oils, essential oils, to rub on you, which kind of it it puts you in a relaxing mood. They don't necessarily concentrate on one particular part of the body, but they do give a full body rub. Next up is a deep tissue massage, which is more forceful. It's more like a deeper massage. You know, this is if you feel like you've been already used to a regular massage and you need more force to kind of get into the actual point of your pain. There's sports massage, which can be full or partial massage. They can do a whole body, or they'll just focus mainly on the point of your pain. This can be done with or without clothes, and it's usually to prevent injury. Next up is the shiatsu massage. It's more like you're sitting on like a massage chair and there's like a pulse, but this is just you and the person, and you're laid out on the table, and their hands are moving in like a pulsing motion, like some kind of vibration, like a rhythm, to make you feel like, you know, something is happening. um, so they do that, and there's more force with that. This does help to relieve a lot of pressure and tension, and it's also relaxing. Next up is Thai massage, which is something like kind of like a yoga, Pilates. It's very physical. The therapist is like twisting your body, moving your body, pushing and like kneading your muscles, and like your legs are being put in certain positions, and it's just active. It's just like something to get you like flowing, get the blood flowing. And you can have your clothes on while they're doing that. There's also prenatal massages, which is not recommended for early trimester pregnancies, but women do go and they get it done for, and they concentrate on like the bottom half of your body, like your hips, you know, your legs, your thighs, which is like where a lot of your weight goes to, a lot of pressure. So they help to relieve you with that. You could be partially undressed in that situation, and they lay you down on a table that's specifically for women who are, you know, expecting. It's cut out into the shape of the body. There is the chair massage, which is just like you sitting in a chair. You could, I know people see that when you're in the mall, you're walking around and they're like, oh, hey, do you want a quick massage? And you just sit on a little chair and they're just going at you. This is usually just the top part of your body, your neck, you know, your shoulders, your upper back. Um, Sometimes your lower back, and you obviously are clothed with this, and it does relieve tension. You know, it's I've had that experience and it feels pretty good. So with all of these alternative methods, which I prefer over seeing actual, you know, medical doctors, um, I like the I like the holistic approach to dealing with back pain, and it's more relaxing. I feel like um, it's more personal, hands-on, and I feel like the actual person that's working on me has more of a heartfelt feeling. It's like it's more personal. They're not just, obviously they do get paid, but they have a different mindset when they're approaching this. It's not just, okay, let me just give you a quick shot and boom, that's it. They're actually putting in their heart, their soul into helping you to feel better because of how they think about pain. and the body and the universe and how everything works. It took 2 years to put together a framework and routine that reduced my degenerative disc disease back pain. If you want help to speed up your recovery time, leave a comment. Please tune in. And yeah, next up is a reflexologist. Actually,